Good afternoon, everybody. How are you? I'm Donald Clark. I'm one of the acupuncturists here at CMI Healing Arts, CMI Fertility. I hope you're all well. If um, if this video is not coming through like it should, sound, optics, and visual, let me know. We've been having some technical difficulties. I hope everyone is well. Summer is really kicking in up here in upstate New York, as I'm sure it is across the northern part of the country. And I know for a fact that it's been very, very hot in the south, all the way from Florida to Texas. So here we go, going into the summer months, and we've been looking forward to it for a long time. I getting my garden ready. My girls and I have been busy trying to get to the garden as much as we can, and we've got lots of flowers picked out, lots of flowers started. So we're looking forward to having lots of color and beautiful butterflies and bees and hummingbirds around this summer. So I wanted to talk a little bit about the title of this Facebook Live is Common Myths, right? So I just wanted to go over some of the common questions that I get from patients about acupuncture and their fertility treatments and or their transfers. And so I'm just going to kind of gloss over some of the big topics, but we're going to get to some of the common myths about all of this. And the first one I'm going to start off with is, do cold foods hurt me? And the question, that's kind of it can go either way. So do cold foods hurt you? No. However, if you consistently drink ice water throughout the day, and you eat, say, yogurt or some raw foods, yes, they will hurt you, because what it does is it lowers the temperature of your stomach to the point where it starts to affect your digestion, right? So we need it to come up to a level of temperature, and it has to be in an environment for the acids to start breaking the food down and digesting it, right? So if we're constantly eating cold, raw foods, it takes a bit longer to bring that temperature up and then that stomach environment up to a digestion level. So are cold foods bad? No, cold foods aren't bad. You just need to moderate the cold foods. And one of the best ways, to do that is let's say you had avocado that came out of the fridge, delicious avocado, perfect. And then you had, say, ice water with that, that's fine. But the best way to remedy that, so it doesn't start to affect your digestion and or affect absorption rates, drink some warm water, right? If you're at a restaurant, ask for some tea, and you don't have to have tea, just have warm water. So if you drink some warm water, what that does is it'll help bring that temperature in the stomach up to a more appealing environment for digestion to begin. So are cold foods bad? No, not at all. And it goes back to that, my acupuncturist said I should be eating warm foods. True, you should be eating easily digestible warm foods. But cold foods are okay too. I mean, it is what it is, and you're going to eat what you want to eat. But if you're eating lots of cold food, just have some warm water, and that's going to bring it up to temperature. And don't be afraid of the cold foods. Don't be afraid of the cold raw foods. And that, I think that's pretty self-explanatory. Warm water. Cold feet. If I have cold feet, do I have bad fertility? No, you don't. You may have, some circulation that can be improved on, but because you have cold feet or cold hands all the time doesn't mean you're infertile by any means. It just maybe means you're cold a lot, and that can be from a few other reasons why. Or it could just mean we need to circulate your blood, your chi a little bit more. And acupuncture is really good at that. So if you constantly have cold feet, cold hands, don't hit the panic button. And if you're pregnant and or trying to have a family, or you've just done a transfer or an IUI, you don't have to walk around with these big, thick wool socks on. It's okay. If you're cold, get warm, right? If you're warm but have cold extremities, you just need some mild chi tonification, and that's really easy to do. So don't worry too much about it. A question I get a lot is, hello everyone. Hi. The question that I get a lot is, can I have sex and intercourse after my transfer? And there really are no restrictions unless you decide to put restrictions on yourself, and that's totally understandable. But as far as intercourse goes after an embryo transfer, it's really your comfort level. I do recommend maybe wait a day or so, and then move forward. But that's truly up to you. So there's no restrictions. In Chinese medicine, intercourse during pregnancy is forbidden, right? And so the idea is that you want to focus all that jing, all that energy on your developing baby. That's up to you, and a healthy relationship, if that includes intercourse, is very important as well. So weigh it out, look at your limitations and what you want, what you and your partner want. But as far as intercourse after transfer, it's okay. I do recommend you wait a day or so. Let's see. Exercise, moderate, mild exercise, while trying to, go through an IVF cycle and or family planning, fertility treatments is okay. Well, I think yoga is okay. I think walking is okay. I don't really like exercise while family planning. And so some people say, it's okay. Other centers have other views, and that's fine. I'm just talking about my view. And I think what it does, I think it sends the wrong signals to the reproductive system. And we don't really want that. We want nesting. We want relaxation. We want less work hours. We want, it's not the time for overtime when you're planning a family or trying to get pregnant. Not the time for it. Those are decisions that you have to make, obviously. But we want you to be really relaxed and less stress, the least amount of stress possible. That's how we prefer. So is exercise okay during trying to get pregnant? Yes, it is. However, it's not advisable at all, as far as I'm concerned. So is it the make or break? Could be. If you're training for a marathon or a biathlon, or it's your job to be a instructor or a fitness instructor, it could make it very difficult to conceive and or keep the pregnancy. So I recommend you slow down. And if you're going 100 miles an hour and you slow it down to 75, 60 miles an hour, your body recognizes that and it moves forward. So, you don't have to completely cut it out, but I do recommend you scale it back a lot, to nothing really. This is a topic that I've learned a lot on recently, with conversations with Dr. Kiltz and other readings that I have personally grown to understand a little bit more. So I used to truly believe that a high caloric diet was better for fertility than a low caloric diet, and I based that on some husbandry stuff that I've looked at in the past. But further reading, and as more information comes out about a low caloric diet, you can see the benefits of a high fat, low caloric diet in fertility. So this next myth is more food better? Not necessarily. It's actually sometimes can harm you. Everyone, I mean, I should say everybody, but it's been common knowledge for quite some time that an undernourished body is healthier than an overnourished body, and that's common. But set that aside and look at fertility, and it's coming to my attention and to others in the field that it is true an undernourished body is a little bit more fertile than an overnourished body, and you can see huge benefits from that, especially with uh, decreasing inflammation, right, and egg quality. So, what should I do? I do, I do recommend, or I encourage people to decrease their caloric intake, and you do that how you need to do that. And I also encourage people to include higher fat foods, and of course that goes right back to, um, your fats, your butter, your eggs, your bacon, um, meats, and the fat on the meat. So we're brought up, or I was brought up cutting fat off of meat because it was bad for you. But everyone knows it tastes really good, right? But we were all told, it's bad for you. But it really is not bad for you. So I encourage you to eat the fats that are on the fish or the meats. And what will happen is that your body will be much fuller, right? And it'll be much more content. And you won't have these cravings that people get for empty calories, carbs, sugars, all of that. So the old myth that more is better is not true. Less is better. So lower your caloric intake, eat smarter, higher fat, denser foods, and cut out all the sugars and cut out all the calories. Okay. And, obviously you're going to do it to your comfort level and to your best abilities. So don't beat yourself up, if it's a journey, because life is a journey. And if you don't embrace that, then you're going to just keep running into a wall. So embrace your journey, right? Own that journey. Let's see. Grades of embryos. I'm kind of stepping out of um, my expertise, but I can comment on it. I've been here long enough time to know that I've seen the worst embryos do great and the best embryos not do so well. So you have to remember that it's not about the grading, although grading is great because you get a grade and you get an idea of where the embryo is in its development. But it's not about the grade, right? It's about the life force in that embryo or in that egg or in that follicle. It's about the life force. And if there's one thing I've learned in this world, in this lifetime, is that nothing goes to waste, especially in nature, especially in fertility. You might start off with 7 and end up with 2, but let me tell you that life force in all 7 have been condensed into 2. That's Nature's way of, streamlining, being efficient. So don't get too hung up on grading, right? Because it's all about the life force in it, and so keep that in mind, and hold on to that power, right? Because we often get lost in other people's opinions of us and our health and our progress. Don't let that happen. Hold that power. That's the one thing you need to do in this journey of family planning and fertility is retain your power, right? Retain your view, your knowledge, and your self-love. All right. So don't worry about grading. It's nothing goes to waste, and everything is powerful, especially when it comes to life force. Life finds a way. Okay. It's it might escape us from time to time, but it always finds a way. So hold on to that power. Here's a very common question. Does acupuncture hurt? Good question, right? No. I mean, sometimes you feel it, right? And you can tell you're having acupuncture. But in all honesty, I would say between 85 to 90% of everybody I do acupuncture on, the thousands and thousands and thousands of people, 85, 90% of them all fall asleep. So you might feel it initially, and it's not hurt. It's more a like a heavy sensation on the skin, like maybe someone's pinching you, but not to the point where it hurts, but you can feel it. And then you just drift off. Your brain patterns slow down. They go from an awake functioning pattern to a sleep pattern, so everything kind of just settles right in. The brain tells the body, "Hey, I'm sleeping. You should be sleeping too." And then your body falls asleep. So you get this really earthy, deep earthy sensation, I should say, or feeling. And most people drift off. So does acupuncture hurt? It can, especially if I'm treating, like for instance, if I was treating somebody who sprained their ankle and they have it's a new injury, and I need to go into the area that's torn. Yes, it could hurt because it's so inflamed. But generally speaking, does acupuncture hurt? No, not at all. There's some misconceptions. The more it hurts, the better the treatment because you're moving more chi, or it hurt because it needed to hurt, or it hurt because the acupuncture was the chi was stagnant in that area. I don't really go that route. I was taught that you, as an acupuncturist, need to feel the pain just before your patient feels it. So you feel the chi just before the patient feels it. And that way you get the response and you move the energy without the pain. That's how we do acupuncture here. So here's another misconception. Is acupuncture safe? Well, yes, it is safe. And it's safe because, some acupuncturists, and let me say that it's very rare and far and few in between. You might see it in other countries, China. They autoclave their needles. So they take their needles and they reuse them, autoclave them and sterilize them. We don't do that. We use disposable needles. So that needle, actually I have some. So these needles come in a blister pack. And once that needle is opened, it's in a guide tube. And then we break that guide tube and the needle shoots out. It's so thin you can't even see it. It shoots out and it goes from you into a sharps container, never to be seen by the light of day again. So we use disposable needles here, so it's very safe. Some people use alcohol on the skin to sterilize the skin and swab the skin. That's what we do here, and some people don't, and there's different views on that. But we at CNY Healing Arts we swab the skin with alcohol, and everything's very sterile and everything's very safe, and nothing is reused. It's all disposable, so you don't have to worry about that. Let's see. Bed rest after embryo transfer and or a pregnancy, or during a pregnancy. I don't recommend bed rest. I don't recommend strenuous exercise, but I do not recommend bed rest. It's kind of one of those. It's kind of that same thing, You want your blood and chi moving and flowing in a normal level. Bed rest, I don't recommend it because you don't get that, and it's uncomfortable anyway. So if you have your embryo transfer, be normal. Just give yourself some little bit more downtime and no exercise, but it's okay to walk. A lot of patients ask, is it okay to travel? I want to travel home. I want to fly home. I want to drive home. And one of the great things here is we see people from all around the country, and it's so awesome to hear, different stories about different parts of the country. And sometimes people drive, and it's quite okay to drive. It's okay to fly. It's okay to fly. What I recommend, and what most of the doctors here recommend as well, is that if you're sitting for more than an hour and a half to 2 hours, stand up. Or if you're walk around for a few minutes. If you're driving, go to a rest stop or a text stop, someplace safe. Walk around for 2 minutes, 3 minutes. That's all, and then carry forth. And you don't, what we're trying to prevent is you just sitting for long periods of time. We see, being in Syracuse, we're kind of smack dab in the middle of Toronto, Montreal, Philadelphia, New York City, and those are all 4 to 5 hours. So we just get lots of people driving, and their question is it okay to drive or ride? And yes, it is. You just need to stop like every hour and a half and walk around a little bit. And the last one I have is our fertility treatments really the only answer for my infertility? That depends on a few factors, but generally speaking, not so. If you're having issues with endometriosis or PCOS or undiagnosed, right? That we see a ton of undiagnosed. Give acupuncture or healing art. Give healing arts as a whole, massage, acupuncture, yoga, meditation. Give yourself some time. You'll be amazed at how effective natural treatments are. Don't get me wrong, IVF is a beautiful, wonderful thing. And but before you jump into that ocean, dip your toes into Chinese medicine a little bit. Dip your toes into massage therapy for fertility, yoga, meditation, lifestyle changes. So IVF isn't the only way to treat your fertility issues. There's a lot of other modalities out there that work incredibly well. I mean, I say it again, and I'm blessed every day that I'm here. I am practicing an art, a medicine that's thousands of years old, and I am in this place, and this is a state-of-the-art facility. And so it just goes to show you that it's effective and it works. So, and it's cost effective too, which is a huge factor. So you have options, and the awesome thing is that you have options under one roof at CNY Fertility. So, keep that in mind. Okay. Sorry, I don't have my glasses today, so I'm really having a hard time reading. So there's some stuff. I see lots of highs. Hello. I see something about losing weight. I can honestly say that if you go high fat, keto, carnivore, you're going to lose weight. And so as far as your BMI limit, again, I cannot stress enough how being lumped into charts and statistics and other people's views on where we're at is so wrong. So if your weight is causing other health issues, then sure, lose some weight, but don't let it if you're fine otherwise, then keep that in mind. Trust in the process, trust in your instincts. If you think losing weight is going to help, then lose weight. If you want to lose weight effectively and fast and do great things for your fertility, go carno, go keto, and I think you'll be happy with that. Low intensity, I'm assuming it's for exercise. And yeah, low intensity. I'm a bit conservative when it comes to exercise. So I'm gonna be like, yeah, don't exercise. Go walk outside. Go, go bird watching. Do some art. Paint a picture. But if you want to go for a hike and go bird watching, or go for a hike and low intensity. Go for walks, stuff like that. Then sure. But yeah, stay away from the hardcore stuff. The high weights and the cardio and all that. I don't know if CNY has a limit on weight. I'm guessing weight, right? I don't know. To be honest with you, I wouldn't think so. I honestly wouldn't. That would be new. That would be a new concept for me here. So I don't think so. Wednesdays, I am available for consultations. So by all means, give me a shout out and schedule it. We can talk. Here's another misconception. You need to have a consultation before you make an appointment. That's not true at all. You can make an acupuncture appointment and we can go over everything as well. But if you just have general questions and you want to chit chat, get on the books for Wednesday and we can do a consultation on Wednesday. Shady Grove. I hear they're great. Okay, you guys, have a nice weekend. Remember those that have fallen for us on Memorial Day. And we'll talk to you soon. Thank you.